Hello everyone, friends. In today's video, we'll go over the 3 most common mistakes that slow down your blog's growth and prevent you from turning followers into real patients. Let me tell you a little about myself. My name is Dmitry Ryabov. I'm a dentist, prosthodontist and surgeon with 10 years of practical experience, and I've been running a blog for doctors for over 5 years. I've recorded over 100 podcasts with the best doctors in the country and around the world. I'm also the author of the book The Doctor's Personal Brand, which has already been read by several thousand doctors. For several years now, I've been teaching doctors how to build a strong personal brand and turn their blog into a working tool. Over the past 3 years, I've helped dozens of dentists go online, build their blogs, and consistently attract patients. So, what about the mistakes when it comes to running your dental blog? The first mistake is running your blog not for patients but for your colleagues. That is, you post things like retraction, isolation, class 4, composite, and so on. It looks nice, it's scientific, but it's incomprehensible. The patient is not a doctor. They don't want to get into the technical details. They just want to understand. Is it safe? Is it clear? And can they trust you? How can you fix this? Write in simpler terms. Speak to people as you would to a person, not as if you're at a department meeting. Tell stories, not protocols. Use visuals that are easier for patients to understand. The second mistake is when you focus solely on the clinical result. In other words, there are teeth, there are photos, but who are you? What kind of person are you? What kind of doctor are you? People don't just come for photos of your work, they come for the doctor's personality. Because for them, it's important not only what kind of professional you are, but also what kind of person you are. Because they're going to a doctor, and that's a very close, tactile interaction. The patient should feel, I trust this person, I trust this doctor. How can this be fixed? Show up in your stories more often, at least 2 or 3 times a week. Talk about yourself. What is important to you in your work? How do you deal with patients' fears? Don't be afraid to be real and alive. This doesn't diminish your expertise. On the contrary, it strengthens trust. The third mistake is when you lack a system. One day you post stories, the next day a reel, and then you disappear from your blog for a month. There's no positioning, no content plan, no understanding of why or for what purpose you're running this blog at all. It's like treating teeth without diagnostics, without knowing the diagnosis. How can this be fixed? You need to define your strategy. Who do you want to attract to your blog? Who is your target audience? Build your content in stages, introduction, building trust, and motivating people to sign up. Plan ahead. An effective blog isn't chaos. It's a clearly planned system. If you recognized yourself in at least one of these mistakes, that's okay. But your blog can and should work for you. In the course Dentist's Blog, you will get positioning that will set you apart.